What happens to the bone if after extracting this tooth I do nothing? That's a very good question, dear Mr. Giovanna. Fortunately, we do have some time to decide. When a tooth is extracted and not replaced, the alveolar bone, the bone that holds and anchors the tooth in the mouth, begins to slowly resorb. At the same time, the neighboring and opposing teeth start to move, more or less quickly depending on the individual. This process can take months or years, and its extent is never fully predictable. Time, however, is always an important clinical factor. That's why replacing a tooth with an immediate implant can be a valid solution when indicated and when done at the right time, usually as soon as possible. Even after a couple of months, it can still be appropriate, and sometimes it's even better to wait a bit. The key is to carefully evaluate the manufacturers. I can explain this, at least in part, with a drawing or an X-ray as usual. A case where a tooth has been missing for many years is rarely well organized. Typically, when a tooth has been lacking for a long time, the adjacent teeth begin to tilt, making the situation more complex. They shift forward in an attempt to close the gap. This is why it's important to always replace a missing tooth either with a fixed bridge or with an implant. In cases where a root is severely damaged and needs to be replaced, we are talking about the post-extraction implant. If the neighboring teeth are perfectly healthy, as in the example I'm showing here, it's often best choice to extract the tooth. If there is an infection or a bone lesion, it may be better to wait a bit before placing the implant. In some cases, however, the implant can be placed immediately after extraction, and this is called an immediate post-extraction implant. In any case, an immediate implant helps preserve bone volume and maintain both aesthetics and functional parameters. However, it can also be a good approach to extract the tooth, allow proper healing, and then place the implant later. The implant replaces the root of the tooth and is then completed with a crown, a new tooth, thus respecting the neighboring teeth while restoring the dental arch. In the panoramic X-ray I'm showing you of one of my patients, you can see that she did not replace some missing teeth in time. 2 lower molars on the right and the left. As a result, the second molars tilted noticeably forward mesially. There were also changes in the upper arch. For example, on one side the molar has over-erupted slightly, while on the other side the molar has tilted and moved closer, completely closing the space. When a tooth is missing, the balance of the entire arch and in fact the whole mouth changes. Adjacent teeth tend to tilt into the empty space, and the opposing tooth may extrude because it no longer has contact. This alters occlusal forces, creates areas of overload, and makes future rehabilitation more complex. Meanwhile, the bone in the edentulous area, the area where the tooth was present, begins to resorb. Less bone means fewer treatment options over time. Not replacing a tooth is not actually a neutral choice. It is a decision that progressively alters the biological balance of your mouth. The right decision is not to always intervene, but to know when to act before the situation becomes more complex to manage.